Narcissism is a term that often refers to excessive self-focus and self-centeredness. Contrary to the misconception of self-love, true narcissism in psychological terms, specifically narcissistic personality disorder, goes beyond mere vanity or self-obsession. Instead, it reveals an intriguing truth. Individuals with narcissistic personality disorder are captivated by an exaggerated, larger-than-life image they have constructed within their minds. In this video, Insight Central will dive deep into narcissistic personality disorder. So let's dive right in. Definition and diagnostic criteria. Narcissistic personality disorder, commonly known as NPD, is a mental health condition classified as a personality disorder. According to the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, it is characterized by a persistent pattern of grandiosity, a deep need for admiration, and a lack of empathy for others. To diagnose narcissistic personality disorder, mental health professionals look for specific criteria. This includes an exaggerated sense of self-importance, a constant need for attention and admiration, a belief in one's exceptional abilities, and a tendency to exploit others for personal gain. Individuals with NPD often have fragile self-esteem that is easily threatened by criticism or perceived rejection. Causes and risk factors. The causes of NPD are complex and can be influenced by various factors. While genetics may play a role, environmental factors such as childhood experiences and upbringing are equally important. For example, individuals who grew up in an environment where they were excessively praised or criticized may be more susceptible to developing NPD. It's important to note that not everyone with a narcissistic personality develops NPD. However, certain risk factors, such as a history of neglect or abuse, can increase the likelihood of its development. It's a combination of genetic predisposition and environmental factors that contribute to the manifestation of NPD. Symptoms and characteristics. Now let's take a closer look at the symptoms and characteristics commonly associated with narcissistic personality disorder. People with NPD often have an inflated sense of self-importance and believe that they are superior to others. They constantly seek attention and validation from others, and their self-worth relies heavily on external praise and admiration. One of the key characteristics of NPD is a lack of empathy. Individuals with NPD struggle to understand or relate to the feelings and needs of others. They often have difficulty forming genuine, deep connections and may exploit others for their own personal gain. Underneath the surface, individuals with NPD often experience deep-rooted insecurity and fragile self-esteem. Their grandiose behaviors and attitudes serve as a defense mechanism to protect themselves from feelings of vulnerability. Impact on relationships and daily life. Living or interacting with someone with narcissistic personality disorder can be challenging. In relationships, individuals with NPD may exhibit manipulative and exploitative behaviors, putting their own needs above those of others. Their constant need for admiration and attention can leave loved ones feeling neglected and emotionally drained. Furthermore, individuals with NPD may struggle to maintain healthy and meaningful relationships due to their difficulty with empathy and genuine emotional connections. This can lead to a cycle of broken relationships and feelings of isolation. Treatment. While there's no specific cure for NPD, treatment options are available to help individuals manage and mitigate the impact of the disorder. However, it's important to know that seeking treatment can be challenging, as individuals with NPD may resist therapy or deny that there is a problem. They often resist the idea that something might be amiss, making them less inclined to actively seek treatment. However, in the rare instances where they do seek help, it's typically driven by other associated issues such as depression, substance abuse, or co-occurring mental health conditions. Due to their heightened sensitivity to perceived insults or threats to their self-esteem, individuals with NPD may find it challenging to acknowledge and commit to the treatment process. Treatments for narcissistic personality disorder primarily involve psychotherapy, also known as talk therapy. Psychotherapy is the cornerstone of treatments for narcissistic personality disorder. The main objectives of psychotherapy are to help individuals take responsibility for their actions, cultivate genuine personal connections, and collaborate effectively with colleagues. It also assists in developing a realistic self-perception, allowing for the acceptance of criticism and the ability to handle failures. Therapy aids in enhancing emotional understanding and management, addressing self-esteem issues, and setting achievable goals rather than pursuing unrealistic ideals. Therapy duration can vary, with short-term interventions utilized during times of stress or crisis, while ongoing therapy supports individuals in achieving and maintaining their goals. In some cases, involving family members or significant others in the therapeutic process can be beneficial. It's important to know that there are no specific medications designed for treating narcissistic personality disorder itself. However, if accompanying symptoms such as depressions or anxiety are present, medications like antidepressants or anti-anxiety drugs may be prescribed to alleviate those symptoms. Remember, treatments for narcissistic personality disorder requires the guidance of qualified mental health professionals who can tailor their approach to individual needs and circumstances. Coping strategies for dealing with people with NPD. If you find yourself in a relationship or situations involving someone with narcissistic personality disorder, there are some coping strategies you can employ to navigate the challenges and protect your well-being. First and foremost, it's crucial to establish and maintain clear boundaries. Recognize your own needs and values and communicate them assertively. By setting boundaries, you can protect yourself from manipulation or exploitation while maintaining your own sense of autonomy. Practicing self-care is another essential aspect of coping with NPD. Nurture your own emotional well-being by engaging in hobbies, spending time with supportive friends and families, and seeking professional help if needed. Improving communication skills can also help to minimize conflicts with individuals with NPD. It's important to express yourself calmly and assertively, using I statements to convey your thoughts and feelings. Active listening and empathy can be powerful tools in fostering healthier interactions. Remember that you cannot change or control someone with NPD. Focus on taking care of yourself and seeking support from trusted friends, families, or mental health professionals who can provide guidance and understanding. We hope this video has provided you with valuable insights into narcissistic personality disorder. You might be interested in learning more about social anxiety disorder. Check it out. Thanks for watching.